Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Speaking on behalf of the province today are the province's Chief Medical Officer of Health, Dr. Jennifer Russell, and the Honorable Blaine Higgs, Premier of New Brunswick. Bon après-midi tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui sont le médecin hygiéniste en chef, le Dr. Jennifer Russell, et le Premier ministre, l'Honorable Blaine Higgs. Dr. Russell.
I know, but can we adjust that? I know, but it's distracting.
Quand on commence, before we start, can everybody please mute your microphones? Merci beaucoup.
Thank you, Bruce. Merci, Bruce. Good afternoon, everyone. Bonjour à toutes et à tous. Before I begin my official comments, I just wanted to provide a little bit of an update in relation to some information that I gave around essential workers. With respect to workers who come into New Brunswick, whether on contract or what have you, WorkSafe New Brunswick has work isolation plans for those people. And WorkSafe New Brunswick, with respect to those isolation plans, require the workers to remain self-isolated while not at work for the first 14 days. And the sponsoring company has an obligation to ensure compliance with this requirement. And with respect to other types of essential workers, for example, New Brunswickers who travel outside of New Brunswick to work, again, those exemptions that I was talking about were referring to that group of workers. So with respect to the conversations that we're having about making things as safe as possible in the future. The outbreak at the Manoir Notre-Dame Special Care Home really should demonstrate to all New Brunswickers that the second wave of the COVID-19 pandemic is upon us. And just before I carry on with that, I will just go over the public exposures that we mentioned yesterday. I didn't have all the details in front of me, so I'm just going to go through those right now. So at the Optical Center, Costco in Moncton, on October 1st, between 4 p.m. and 8 p.m., October 2nd, 12:30 p.m. to 9 p.m., and October 5th, 8:30 a.m. to 5 p.m., and the St. Hubert restaurant in Moncton from October 3rd to 11:15 a.m. to 4:30 p.m., October 4th from 11:15 a.m. to 3:30 p.m. and 4 p.m. to 8 p.m. So people who have visited these locations since October 1st should self-monitor for symptoms for 14 days. And should any COVID-19 symptoms develop, you're directed to self-isolate and call 811 to get tested or take the self-assessment online, which can get you a referral for a test as well. Je vais répéter ça en français. Alors, les endroits où on croit que la public pourrait être en risque, c'est au centre optical de Costco à Moncton, le 1er octobre de 4 heures l'après-midi jusqu'à 8 heures le soir, le 2 octobre, midi et demi jusqu'à 9 heures le soir, le 5 octobre, 8 heures et demie le matin jusqu'à 5 heures le soir, et au Saint-Hubert restaurant à Moncton, le 3 octobre de 11h15 le matin jusqu'à 4h30, et le 4 octobre de 11h15 le matin jusqu'à 3h30 l'après-midi et 4 heures dans l'après-midi jusqu'à 8 heures le soir. Alors, si vous avez visité ces endroits durant ces périodes, on vous demande de vous assurer que vous n'avez pas des symptômes pendant les prochaines 14 jours. Et si vous avez des symptômes, vous pouvez téléphoner soit 811 ou aller en ligne pour avoir un référent pour être testé pour le COVID-19. So, COVID-19 is not just around us in other provinces and states, but it's here in New Brunswick, and we have to deal with it. Alors, grâce à nos mesures de santé publique proactives et au maintenant de la bulle atlantique, le nombre de cas est demeuré faible cet été. Toute la province est dans la phase jaune du rétablissement depuis la fin de juin. And everyone wants us to stay in the yellow phase, that's clear, and nobody wants to go back to more restrictive measures that we saw in the spring. As we know, it really impacted people's mental health, it impacted their physical health, and obviously there are many secondary effects and impacts on people's income, on the economy, etc. So, but in order to stay in the yellow, we all have to act together. We can't wait for the virus to come to us. It is much easier to stay ahead of outbreaks as opposed to catching up. So everybody's working very, very hard in the Moncton area right now to make sure that everything that can be done is being done in that situation. So we must be proactive and determined to slow the spread of COVID-19 before it takes hold in our province. And so keep the folks in Moncton in your thoughts right now. Offer them support. Check in on your neighbors and friends who might be involved in the situation, whether as people who are self-isolating, whether people who have tested positive, or healthcare workers who are involved in the situation in their care and their families. So this situation requires that we take more steps in controlling the spread of infection. And for this reason, Public Health is recommending to the Premier and the COVID-19 Cabinet that masks be required in most indoor public spaces in New Brunswick. And this is a similar approach that Nova Scotia has taken. The Premier will speak to the details of the Cabinet's revision to the provincial emergency order in a few minutes. Alors, c'est pourquoi que la santé publique a recommandé au Premier ministre et au comité du cabinet sur le COVID-19 d'imposer le port du masque dans la plupart des lieux publics intérieurs du Nouveau-Brunswick, comme les ordres au Nouvelle-Écosse. Alors, le Premier ministre reviendra en détail sur les modifications apportées à l'arrêté obligatoire provincial dans quelques minutes. Today, there are 3 new cases of COVID-19 reported in New Brunswick. Now, these ones are not related to the outbreak in Moncton. We will still have ongoing testing to continue to monitor that situation with respect to close contacts and people who are symptomatic. But the 3 new cases that I'm reporting on today are not linked to that outbreak. So one of the new cases is an individual from the ages of 40 to 49 residing in Zone 2, which is the St. John region. That is a travel-related case, and the person has been self-isolating. There's an individual aged 20 to 29 residing in Zone 3 in the Fredericton region, also travel-related. They are self-isolating and have been. And there's an individual aged 30 to 39 residing in Zone 5 in the Hamilton-Restigouche region, and the investigation for that particular case is ongoing. The first 2 cases, as I mentioned, are related to travel outside the Atlantic bubble, and the case in Zone 5 remains under investigation. At this time, I've already announced the public exposure, but there's one more public exposure that I need to mention, and that is a positive case of somebody who traveled, who may have been infectious on October the 4th on the following flights: Air Canada Flight 418 from Toronto to Montreal, and Air Canada Flight 8792 from Montreal to St. John. Aujourd'hui, il y a 3 nouveaux cas confirmés de COVID-19 au Nouveau-Brunswick. Les cas sont suivants. Une personne âgée entre 40 et 49 ans qui habite dans la zone 2, la région de Saint-Jean. Une personne âgée entre 20 et 29 ans qui habite dans la zone 3, la région de Fredericton. Une personne âgée entre 30 et 39 ans qui habite dans la zone 5, la région de Hamilton-Restigouche. Les 2 premiers cas sont reliés à des voyages à l'extérieur de la bulle atlantique, et le cas dans la zone du Nord continue à faire l'objet d'une enquête. Et les 2 premiers cas, on savait qu'ils isolaient durant le temps qui ont été diagnostiqués. Le nombre de cas reliés à l'éclosion de manoir Notre-Dame est donc toujours de 19, soit 13 résidents, 4 membres du personnel et 2 membres de la famille ou contacts étroits. Il y aura d'autres résultats qu'on recevrait dans les prochaines 24 heures. Alors, on continue à surveiller la situation. The number of cases connected to the Manoir Notre-Dame outbreak remains at 19, 13 residents, 4 staff, and 2 family members of a resident case. 3 of these individuals are now in hospital, with 1 under intensive care. And I can tell you that 90 individuals beyond the Manoir residents and staff have been contacted through contact tracing. This work continues, and the cause of the outbreak remains under investigation. And to show how diligent the work has been going in terms of the efforts, they have even done contact tracing with folks who have tested negative as residents and staff, because they really want to make sure that they don't miss anything. So they're really leaving no stone unturned. So I really appreciate the work of the public health team on the ground, along with social development, EMP extramural program as well as the RHAs. So to further slow the spread of the infection, visiting is now prohibited at adult residential facilities in the Moncton region until further notice. And physicians have been asked to be on high alert for any patients exhibiting symptoms of COVID-19, particularly among the elderly and other vulnerable groups. Afin de ralentir davantage la propagation du virus, les résidents des établissements de soins de longue durée à la zone 1, région de Moncton, ne seront plus autorisés à faire des visites à l'extérieur et ne pourront plus recevoir des visiteurs jusqu'à un nouvel ordre. Nous avons demandé aux médecins d'être sur un pied d'alerte et de surveiller l'apparition de tous symptômes de la COVID-19 chez leurs patients, en particulier chez les aînés et les autres personnes vulnérables. The manual Notre Dame outbreak has led to a surge in requests for testing, and I urge everyone to continually monitor their health and seek testing if symptoms of COVID-19 emerge. To assist in our testing process, I ask everyone to use the online form to request a test on the GNB website. It is fast and it's really easy to use. It is important for all New Brunswickers to regularly monitor their health and watch for symptoms of COVID-19 at all times. And it's vital that we stay ahead of the virus and do all that we can to slow its spread. So this is one of the main reasons that Public Health is recommending to Cabinet to use community face masks in public spaces, in most public spaces. And the public use of masks has been steadily increasing, and we see it every day in shops, workplaces, and other public spaces. Cette situation est encourageante parce que pour protéger les personnes les plus vulnérables, nous devons avoir une bonne longueur d'avance sur la pandémie. Nous ne pouvons pas attendre d'être débordés par cette crise comme cela s'est produit dans plusieurs des administrations voisines. Il est essentiel d'agir maintenant afin de ralentir davantage la propagation du virus. En portant un masque en public, vous vous protégez et vous protégez les autres. C'est un signe de respect et le fait de porter un masque ou de se couvrir le visage vous empêche de propager la COVID-19 à votre insu et empêche les gens autour de vous la transmettre. It can and will save lives. Masks are a very important tool among the many layers that we have with respect to public health measures to control the spread of COVID-19, and I've mentioned them many times. So our border measures, self-isolation measures, the physical distancing, washing your hands, staying home when you're sick, getting tested if you have symptoms. We really have to have all of these measures in place to protect the entire population of New Brunswick, especially our most vulnerable. So all of those things will be what it takes to have the best chance of slowing the spread of COVID-19. We can't bring the risk down to zero ever during a global pandemic, and we know that. So what can we do to minimize the risks of COVID-19 while protecting our mental health, while protecting our incomes and our ability to have the most normal possible socioeconomic status that we can? La stratégie la plus efficace consiste à porter votre masque et à vous laver les mains, en plus de prendre toutes les autres mesures sanitaires que nous vous avons incité à prendre au cours des 6 derniers mois, je m'excuse. It feels like 10 months, but it's only been 6. Another strategy you can use to help slow the spread of COVID-19 is to download the COVID Alert Exposure Notification app. So if you haven't downloaded this app, this is, again, one more tool in the different layers that we have to protect ourselves. So the COVID Alert Exposure Notification app can be downloaded on your phone through Apple or Google Play and app stores. It's secure, it's reliable, and user-friendly. It enables you to receive notifications. It enables you to know if you have come into close contact with another person who is registered as infected. And again, anything that we can do that, one, decreases your number of close contacts in the first place, or speeds up the time it takes to be able to contact all your close contacts. These are the things that we need to do to stay ahead of COVID-19. As I mentioned before, the travel-related cases in people who were already self-isolating at the time of their diagnosis, could not transmit COVID-19 to anybody. So every single case that was a travel-related case where the people were self-isolating did not transmit COVID-19 to any other person. So again, any of these things that we can have in place to protect the population, that is what we need to do, and we all need to do it together. So I do encourage all New Brunswickers to download and use this app, because obviously the more people that use the app, the more people we can protect with it. And also, I'd just like to mention that with Thanksgiving approaching, and I mentioned this yesterday as well, that we really want to look after one another. So what are all the things that we can do to look after one another? As I said, checking on people, maybe bringing them a turkey, some dinner, not necessarily having your Thanksgiving dinner inside. In fact, somebody sent me a photo of them having their Thanksgiving dinner outside. They decided to do it early, and it was a great idea, and I like to see those kinds of things. So keep your gatherings small. Give people enough space to maintain physical distance. Make it really easy for it to be a safe environment. Have it outdoors if you can, and be aware of your surroundings. If you don't feel well, don't go to a Thanksgiving event. The elderly and those with compromised immune systems need to be particularly cautious. And if someone in your circle can't attend your Thanksgiving event, again, find a way to make the day special for them in another way. We may not be able to have the Thanksgiving that we are accustomed to, but we can still give thanks for living in a beautiful place, in a beautiful province with people who really care about one another, for the abundance that we enjoy, for our good health, and for ourselves and our loved ones. So I wish you all a joyous, fulfilling, and safe Thanksgiving. Thank you very much. Merci.
Bonjour, good afternoon. The outbreak at Manoir Notre-Dame in Moncton is a stark reminder that COVID-19 is still very much all around us. Alors que la pandémie se poursuit, nous devrons utiliser tous les outils disponibles pour nous aider à ralentir la propagation du virus. Cela signifie que nous devrons continuer à laver nos mains, maintenir une distance physique sécuritaire, limiter nos contacts, et rester à la maison quand nous sommes malades. It means downloading the COVID Alert app on your phone to help stay informed. I was hopeful that the majority of people would do the right thing and wear a mask to protect the people around them. Many New Brunswickers do take this rule seriously. We have gotten used to taking our mask with us everywhere we go and putting it on when we aren't able to physically distance. Unfortunately, there are too many people who are still not wearing their mask when required. I mentioned last week that we would be looking for compliance. Since that time, inspection and enforcement officers from the Department of Justice and Public Safety surveyed 600 public spaces across New Brunswick to assess how many people, on average, were using a mask. According to this assessment, the average number of people wearing masks provincially is only 36%. In major urban centers, we've had as low as 16% of the people wearing masks. These numbers are simply not acceptable. This morning, I met with the All-Party Cabinet Committee on COVID-19 and with Cabinet. After much discussion, we've decided that it will be mandatory to wear a mask in all indoor public spaces, effective as of midnight tonight. I recognize that this is a major announcement and businesses and individuals may need some time to adjust. Les agents de la paix feront de la surveillance pour assurer que les gens portent leur masque. Mais ils vont continuer de mettre l'accent sur l'éducation du public. I'm asking people to please comply, as this is another tool we can use to keep New Brunswick in the yellow level of recovery. Children under 2 are exempt from this rule. The small number of people who have a valid medical condition will also be exempt. Everyone else must wear a mask at all times when in public indoor spaces. Resources for businesses are available on the GNB coronavirus website, including signs that can be posted. I know that some people will not agree with this decision, but we've seen how quickly the virus can spread through a community. We must take every possible measure to prevent that from happening in our province. Restricting our borders beyond the Atlantic bubble is another important tool in slowing the spread of COVID-19. Due to the increase of cases in New Brunswick and the rising numbers in Quebec, we have made the difficult decision to once again restrict travel from Listowel First Nation and Pointe-à-la-Croix in Quebec near Campbellton, effective as of midnight tonight. However, children from the communities in Quebec in grades K to 8 who are enrolled in the school in Campbellton will still be allowed to attend. Beginning next Tuesday, October 13th, high school students in these communities will move to remote learning. Residents from these communities will still be able to cross the border to access essential supplies for medical appointments and for approved work reasons, as they have been doing throughout the pandemic. Aside from these reasons, day trips will not be permitted. Ce n'était pas une décision facile, et je sais que l'impact se fera sentir profondément dans la communauté touchée. Mais c'est une décision que nous devrons prendre pour protéger les gens du Nouveau-Brunswick et pour nous aider à demeurer dans la phase jaune. Fortunately, cases are still low within the Atlantic bubble. So beginning today, residents from Nova Scotia, Prince Edward Island, and Newfoundland and Labrador can enter New Brunswick without stopping for screening at our borders. This change will allow us to focus resources where they are needed the most, including screening at other borders and ensuring compliance with guidelines like 14-day self-isolation, gatherings, business operations, and mask use. To improve our border screening and our follow-up with travelers, effective midnight tonight, everyone traveling into Brunswick from outside the Atlantic bubble must pre-register before they arrive. We need information on every traveler to ensure we can follow up. During this pandemic, the situation has changed constantly, and we have all had to do and to adjust accordingly. This has not been easy. It has been difficult for all of us. And I want to thank New Brunswickers for their continued patience, adaptability, and resilience. En respectant les règles, incluant les nouvelles directives sur le port de masque, nous fortisons notre part d'efforts pour protéger les gens autour de nous. We must continue to take care of each other and remember that we are all in this together. If we look after not only ourselves, but our neighbors and our friends, we can continue to set records of positivity in our province. We continue to keep low cases and keep this curve flattened, even through the second wave. Thank you. Merci.
Merci beaucoup, Monsieur le Premier ministre, Dr. Russell. Thank you very much, Dr. Russell and Premier Higgs. We will now proceed with questions from the media. Each reporter will have one question today. You have the right to pose your question in the language of your choice. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue de votre choix. Chaque journaliste aura une question aujourd'hui. Bobby Jean McKinnon, CBC.
Hello? Can you hear me?
Loud and clear.
Oh, sorry. Premier Higgs, how will you make sure that people are following the new mandatory mask rules, and what will you do if they don't?
Well, I think the important thing to consider here is that we are expecting people to look out for each other. We've been successful through this because of that. And we don't see this as a case of enforcement. We see it as a case of people being reasonable with each other, knowing that it is a requirement, knowing that it's expected that people wear masks, certainly in public spaces and indoors. We now have businesses have the ability to certainly enforce these requirements, or in any public space to say, this is the law of New Brunswick. It's important that we focus on this sort influence upon each other rather than enforcement right now. We will continue, and in fact, as I referenced here, we will ramp up our intensity of inspection to see that compliance is very high. And I'll reserve judgment into next steps based on what compliance rate we see, because we know that we are certainly at high risk. We've certainly had an increase in the last few days in our own province, and we've certainly seen what's going on around us. So anyone that will take that for granted is certainly not protecting themselves or their friends or neighbors.
Thank you, Ms. McKinnon. Thank you, Premier. Catherine Poisson, Radio-Canada.
Oui, bonjour. Donc, ma question aujourd'hui, c'est concernant l'accident routier de 2 Québécois qui se rendaient aux îles de la Madeleine. Ils se sont fait dire par un policier de la GRC et par un conducteur de dépanneuses qu'ils n'avaient pas la permission de les embarquer à bord de leur véhicule pour leur porter secours, finalement, en raison de la pandémie. Est-ce que c'est une directive qui vient du gouvernement? Et si oui, est-ce qu'à la lumière de cet accident-là, on prévoit peut-être modifier la procédure?
Yes, I've just learned of that situation, and I think it does provide an opportunity for us to address how that might be handled in the future. It turned out fine at the end of the day. I mean, it involved an accident on the highway, and I think it brought clarity to a vulnerability in a situation where I don't think the individuals would have ever been left alone. But I think having a protocol that would allow us to deal with this, fortunately through the trucking company and that delivered the damaged car and the RCMP, they were able to get to their destination at the end of the day. So we will take this as a lesson learned here of how we might treat it differently going forward, and have a protocol that would be attached to any future type incidents.
Merci, Mademoiselle Poisson. Mia Urquhart, CBC.
My question is for Dr. Russell, please. Have you found enough healthcare workers to fill in at the Manoir Notre Dame?
So in terms of the situation at the Manoir, I received information last evening from extramural around a critical care team that's there. And my understanding is that they had put out a call for other types of workers, and they had a list, but I haven't been updated since then. So my understanding is what they needed with respect to look after the residents was being put in place.
Thank you, Ms. Urquhart. Travis Fortnum, Global.
Hi there. At the Manoir Notre Dame, I'm just wondering if residents who have not tested positive, are their families able to take them out of that home now, or are they being kept in isolation there?
No, nobody in that zone is able to have visits outside right now if they're in those types of facilities. So whether it's an adult residential facility or a long-term care facility, and it's mostly as a result of this situation and out of an abundance of caution. So, and we're going to continue to test even the people that have tested negative. We're going to be testing everybody every couple of days. So the next set of tests are being done tomorrow. So by midnight tomorrow night, we'll have any more positive results from the residents and staff. But we will continue to test even those people that have tested negative already.
Thank you, Mr. Fortnum. Pascal Archinot, l'Acadie Nouvelle.
Oui, bonjour. Ma question est pour la Dr. Russell. Où en êtes-vous sur votre réflexion sur le passage à une phase de confinement plus intense pour la région de Moncton? Est-ce que c'est sur le radar, ça, de retourner en arrière dans le déconfinement?
Oui, absolument. On a des discussions parce qu'on a des critères très spécifiques. Alors, il y a 3 différentes catégories de critères. Une catégorie, c'est sur le sujet de la capacité des hôpitaux, le nombre de chambres, le nombre de lits, le nombre de capacités, la capacité des soins intensifs et la capacité de les employés. L'autre catégorie, c'est la santé publique et la capacité de la santé publique de faire les recherches sur les contacts étroits dans 24 heures. Et ça, on a eu du succès là-dessus. Alors ça va. L'autre critère, c'était vraiment sur si le public suit les directives de santé publique, comme les masques, comme la distanciation physique, avec le changement dans le masque, le port de masque est mandatoire maintenant. Ça a changé ça. Alors, la seule autre catégorie qu'on était inquiète un peu, c'était vraiment au sujet de combien de nombre de cas qu'on a. Est-ce que c'est nombre double dans un tel nombre de jours? Et aussi, si on a la transmission communautaire et s'il y avait une éclosion dans un endroit vulnérable comme celui qui est le manoir. Et avec toute cette information maintenant, on continue nos discussions. À ce moment-ci, on ne fait pas la décision d'aller en arrière à la phase orange, basée sur tous les critères dans les catégories qu'on regarde maintenant.
Merci, M. Rachnak. Héloïse Rodriguez, Radio-Canada.
Oui, allô. J'aimerais vous entendre en français, Dr. Russell, sur les familles qui veulent sortir des résidences du manoir Notre-Dame. Quelles sont vos consignes à ce sujet? Est-ce qu'ils ont le droit de sortir et sinon pourquoi?
Alors, les gens qui sont dans des foyers de soins ou des institutions comme la manoir à Notre-Dame, ils n'ont pas permis d'avoir des visites en hors maintenant. Alors, et on va continuer à tester tous les résidents, même ceux qui ont déjà testé négatif, et on va faire ça pendant plusieurs jours. C'est la même façon qu'on avait géré la situation au nord quand c'était le manoir à la vallée. Alors, c'est pas recommandé maintenant, et je crois que les directives sont là, que les visitations comme ça ne seront pas permises. I did have a request yesterday that if I could repeat some of the questions in English that some of the reporters were asking. So the last question was around, would we consider going back to the orange phase? There are 3 categories of criteria that we look at. We don't quite meet those criteria at this time because there have to be so many met in each criteria. That information is on our website. So at this point in time, we're not prepared to go to the orange phase, but again, things can change at any time. But based on the information we have right now, that's not what we're planning to do. But it's certainly things, we are very aware of all those criteria and having discussions ongoing on that situation. And then for the question that was just asked was around visitation, but I think that question had been asked in English.
Vicky Hogarth, Charlotte County TV.
Thank you, Bruce. My question is for Dr. Russell. Dr. Russell, I understand there's now a COVID-19 testing site in St. Stephen's. Will that be there permanently, and is testing there available to anyone in the area who needs it? And can you just tell us a little bit more about it?
So in terms of pop-up centers, anytime there's a situation where we have to increase capacity and access, then we can do that on a temporary basis. So I'm not sure what the plans are for that particular pop-up center. My understanding it was as a result of the situation in Calais, and just to make sure that access was there. But I know there was an access issue that people were talking about even before that situation. So I haven't spoken with the RHAs recently to find out what the long-term plan is around that. I just know in a general sense, when we do need to increase capacity, pop-up centers are available, and we will consult with Horizon and our other partners around what the future of that particular center is. But again, certainly in the outbreak in the Hamilton region, we had increased access and testing, and certainly now in the Moncton area, we are aware that there probably could be an increased demand there, so we're prepared to deal with those increases in demands as they occur.
Erica Butler, CHMA Sackville.
Thank you. This is regarding the mandatory mask order. I'm wondering if the province is planning any large distribution of community masks to people who may not have multiples already, something like what Nova Scotia did when they made them mandatory.
At this time, we don't have a plan to do so. However, we'll be monitoring and working closely with businesses and other, other associations and understanding, if mask availability is a problem or sourcing masks are a problem, because I think as part of understanding that one's ability to source and supply to meet the needs, we'll work with them to ensure that's possible. So I won't rule it out. It isn't something we have on our radar right now, but with a mandatory mask program, it could be something we may need to look at for sure.
Thank you, Ms. Butler. Savannah Odd, Telegraph Journal.
Hi, my question is for the Premier. Yesterday you seemed a bit uncertain on, our future in the Atlantic bubble if our situation worsens. And as the Thanksgiving weekend is coming up, I'm sure some are wondering, have you heard from any of the Atlantic premiers on whether they feel New Brunswick should stay in the bubble at this time, and maybe what triggers or situations might get us removed from the bubble?
Well, certainly there hasn't been any discussion that I've had with any of my colleagues that would suggest that the bubble is at risk. They've been most supportive of the situation that we are now addressing, and obviously watching closely, as we would do in their situation, and offer of assistance of any kind. I think what we saw in Campbellton back several months ago, the ability for us to rapidly to deal with this situation in Moncton, and the ability for us to contact trace and what we see over the coming couple of weeks would I guess outline what the future steps might be. But I think I need to be very clear that there hasn't been any suggestion of any kind from any of my colleagues that there would be any change to the Atlantic bubble.
Thank you, Ms. Odd. Charles Camiran, TVA, Edmundston.
Oui, ma question s'adresse à Dr. Jennifer Russell concernant le port du masque obligatoire un peu partout au Nouveau-Brunswick dans les endroits publics fermés. Pourquoi vous avez imposé cette mesure-là au gouvernement partout au Nouveau-Brunswick et non dans seulement les zones où il y avait plus de cas, tout simplement?
Alors, c'est une bonne question. Le risque est augmenté en hors de notre bulle atlantique. Alors, à Québec, à l'Ontario, les autres endroits du Canada et aussi les États-Unis, spécifiquement Maine, juste à côté de nous. Alors, quand on voit les risques augmenter, on consulte avec nos épidémiologistes et pour voir c'est quoi qu'on peut faire pour gérer le risque. Alors, pour maintenant, comme le premier ministre a dit, on va changer les directives aux frontières et aussi parce que on dit c'est une éclosion qui est limitée à Moncton à ce moment-ci, la région de Moncton. Ça ne veut pas dire que ça pourrait pas être n'importe où, n'importe quand, parce qu'il y a des gens qui voyagent en hors de la bulle atlantique chaque jour, soit pour des gens en hors de la bulle qui viennent ici pour travailler, ou soit des gens du Brunswick qui sortent du bulle puis retournent après travailler en hors de la bulle. Alors, le risque augmente toujours parce que les nombres de cas augmentent toujours dans les autres endroits en hors de la bulle atlantique.
Merci, M. Camiran. Michel Corriveau, Radio-Canada.
Oui, merci. C'est une question aussi pour Dr. Russell, toujours sur la question du masque. J'aimerais que vous nous expliquiez pourquoi avoir imposé le masque et revenir peut-être sur l'aspect des gens qui respectent ça déjà à l'heure actuelle, qui mettent le masque. Il ne semble pas y en avoir beaucoup qui l'utilisent. Alors, peut-être nous revenir là-dessus. Je sais que le premier ministre expliquait un petit peu en anglais tout à l'heure.
Alors, pour le sujet des masques, on veut que ça soit comme la Nouvelle-Écosse où c'était une situation où on encourage, on donne d'éducation, on fait la socialisation du concept, de l'idée, puis on partagerait le sentiment de nous protéger tous, vous-même et les autres. Alors ça, c'est vraiment le message, parce qu'on sait les risques augmentent en hors de notre bulle atlantique et maintenant dedans la province du Nouveau-Brunswick avec l'éclosion à Moncton. Alors, puis c'est seulement une chose parmi plusieurs qui vont nous protéger. protégés. Alors, les frontières, auto-isolement pendant 14 jours quand vous entrez dans la province, la distanciation physique, laver les mains, diminuer le nombre de contacts étroits. C'est toutes les choses en combination qui vont nous aider. Il n'y a pas une seule chose qui va nous aider avec une pandémie mondiale dans cette situation.
Merci, M. Corriveau. Shane McGee, CBC.
I'm sorry if I missed this already, but has there been any further clarity of where, how this outbreak here in Moncton began, and any better idea at this point?
Hi, Shane. So again, we are looking into all the close contacts of all the cases. As new cases pop up, we will continue to do contact tracing. Sometimes it takes some time to trace things back. It can take several days before it's clear where a case originated, whether it was travel-related or community transmission. So we will be continuing with our investigation, and if we have any more information to share, we will be sharing that information. But as I said, it can take several days.
Thank you, Mr. McGee. Jonathan McInnes, CTV. Jonathan McInnes, CTV.
Hi, sorry, thank you, Bruce. Dr. Russell, have all the residents and staff at the Manoir Notre Dame been tested, and if so, are all of those results back?
Hi there. So we have tested the staff and the residents, and then there were some close contacts that had symptoms, so they were tested. And we will continue with this approach. So we will be testing the residents and staff every few days. We even did contact tracing, as I mentioned, on residents who were testing negative. But again, we know based on our experience up north, we will be continuing with testing. We've done at least 153 tests at this point in time with respect to staff and residents. But again, we need to test every few days because somebody could have tested negative yesterday, but they can test positive tomorrow. And we did see that situation unfold in the Hamilton outbreak.
Thank you, Mr. McInnes. With the Netpol Radio-Canada.
Merci beaucoup, Bruce. La question est pour Dr. Vasso. Bonjour, Dr. Vasso. Alors, des employés ne seraient pas retournés au manoir Notre-Dame depuis les chiffres en cas de COVID-19. J'aimerais savoir si c'est le cas et nous dire il s'agit de combien d'employés du manoir qui ne se sont pas présentés au travail depuis l'exclusion.
Alors, la situation au manoir au sujet des employés, tous les employés sont considérés des contacts étroits. Alors, si on testait négatif, ils pourraient travailler, mais vraiment, ils vont continuer à être testés. S'ils sont positifs, ils vont isoler à la maison. Et s'ils ont des symptômes, ils vont être testés. Alors, ceux qui sont à la maison, ils vont être testés sur la 10e journée, mais s'ils sont au travail, ils vont être testés chaque couple de jours. Alors, l'information que j'ai reçue, c'était qu'il y avait 4 travailleurs de santé qui ont testé positif et il y avait 3 de ces travailleurs de santé qui n'avaient pas des symptômes quand ils ont testé positif. Alors, chaque travailleur de santé et les staffs, ils vont recevoir des suivis avec la santé publique chaque jour.
Merci beaucoup, Mademoiselle Paul. Nicolas Steinbach, Radio-Canada.
Merci. Question pour Dr. Russell, encore une fois. Une histoire dans le Times and Transcript ce matin, Dr. Russell, qui est inquiétante. Je veux savoir votre opinion là-dessus. Une dame qui est une résidente du manoir Notre-Dame, qui présentait des symptômes, qui était hospitalisée à 3 reprises la semaine dernière et qui n'aurait reçu son test que mardi de cette semaine. Est-ce que c'est normal? Est-ce que cette situation vous inquiète? Est-ce que vous êtes au courant de cette situation?
Alors, pour les situations spécifiques, c'est difficile de donner des commentaires. Je sais que dans chaque instance, quand les gens vont à l'hôpital, s'ils ont des symptômes, c'est quelque chose que, s'ils sont testés, c'est vraiment à l'avis de les gens qui prennent soin de eux. Alors, j'ai pas d'informations spécifiques que je peux partager sur des cas spécifiques.
Merci beaucoup, M. Steinbeck. Derek Haggett, Times and Transcript.
Hi there, this question is for Dr. Russell. We've been told that students in the Moncton area went to the Notre Dame Manor. They were not following the exposure. They didn't know they had been exposed. And I'm just wondering what steps are being taken in those schools.
With respect to students who have visited the manoir during the time of the outbreak or in the days preceding?
They went to school following exposure, not knowing they'd been exposed. So we heard of one student in the Moncton area who went to the manor over the weekend and then went to school on Monday.
Well, again, I can't comment on individual situations. All I can tell you is that when public health does their contact tracing, they would be telling people if they are close contacts to self-isolate and if they had symptoms to get tested. So I can't comment on that particular situation at the school because I don't have, again, I can only tell you that what public health does in a general sense during an investigation.
Thank you, Mr. Haggett. Andrew Watt, Telegraph Journal.
Thank you, Bruce. Premier Higgs, I'd like to get you to talk a little bit about this mask rule. The government was going to implement it in early June. It didn't last 24 hours. There's been a lot of question and some criticism from other political leaders, specifically Chris Austin, about this being an iron fist approach and, how do you expect businesses to enforce this? So I'd like to understand more about that and what your philosophy is going to be. Like, are people going to start getting fined or what?
So firstly, the order or the way it was written back in June, it was not a plan for us to implement at that time. It was an error in the order, and so we corrected that quickly. So that was resolved. The tracking, what I said last week, that a mask order could come as soon as October 8th, and I think we're here now, October 8th. And it was based on doing a risk assessment around the province, and which I've quoted the numbers, what we've seen. It's certainly a next step based on the outbreaks we've seen around the province around other provinces next to ours. It's basically now saying, okay, we need to go the next step. We've seen talking with people, we've seen as a result of our surveys that people believe it's a right next step. So the importance in this process was conditioning everyone to do the right thing. Because I've said in other, orders that we've had under the Emergency Measures Act, is that we will never enforce all of this. It isn't conceivable. And if people think they're getting away with something because they can go out and contaminate someone else by not wearing a mask, that's not what this is about. That's not what New Brunswick is about. That's not why we're leading the country in the performance on COVID. It's because people in the province have done just the opposite. They've actually looked after each other. And they've actually gone the extra mile. So I think this outbreak that we've seen in Moncton right now is an eye-opener. It's saying, this is very real. This stuff we're watching around us is real. Now we see it right here in our own province. So will we enforce it at the end of the day? We will never be able to enforce it throughout our province in a way that's necessary to ensure we look after each other. But it will be monitored. We will be looking for the adherence, and we'll decide in terms of what level of adherence we get, whether it's good enough and where the exposures may be. But right now, I'm confident that there's been enough around us and now here amongst us that people are going to say, okay, I can do my part. It's one of those things, I may not like it, but I understand why. And I believe we are at a position now where people in our province will very much understand why and will want to be part of the solution.
Thank you, Mr. Watt. Myriam Donaldson, CIUFM dans la baie de Chaleur.
Bonjour, ma question est pour la personne qui sera à l'aise de s'exprimer en français. Pour notre auditoire francophone, est-ce que vous pouvez répéter et confirmer quelle est la décision de votre gouvernement concernant l'accès aux frontières depuis Pointe-à-la-Croix? Donc, qui peut traverser le pont de JC-Lenoir?
Yes, I can. And, we've been working with Chief Gray in terms of how we could manage the Louisquay connection with a kind of a modified bubble, which we've had over the last several weeks. And we were working with the province of Quebec in order to basically have scrutiny around what was coming into and out of the First Nations community, the travel and the essential travel. And Chief Gray has been extremely cooperative as we've looked at that, because he too wants to protect his community, and he's had a great success record in doing that. So unfortunately, we weren't able to continue with the border operation outside of his community, which we needed help, certainly with the government and with the Quebec Police Force in order to monitor the roadway coming in and out of Chief Gray's reservation. So that's where we are. So given the fact that we cannot protect, and he's unable to protect his community the way he wants to, we have to then put the restrictions on back to where we were. So that means that our border becomes very much watched and controlled from outside of our region, and that means from the northern border into Quebec in this case, or any activity that's moving that is not an essential service. We've been in that mode before, so it's not new. We have pre-registrations, we're online, we can do that, but with the significant outbreak in Quebec, we not only agree that we must make that change, but I dare say, well, I know, because we've had the conversation, that others believe it's necessary as well. So that's where we are.
Merci beaucoup, Mademoiselle Donaldson. Natalie Sturgeon, Telegraph Journal.
Thanks, Bruce. My question is for the Premier. You mentioned that 600 public spaces were monitored by public safety officials. I was wondering what public spaces in St. John were started and what percentage of those were wearing masks. And did New Brunswick wait too long to have this mandatory mask order put in place, given the situation we're facing in Moncton?
Well, so I guess there's a couple. Firstly, we don't believe we waited too long at all, but now's the time to implement. And we haven't had a situation in New Brunswick, and compliance has been high. But we have been saying for the last couple of weeks that there's a need to monitor how well the mandatory rules that were already in place. Because think about this for a minute. We had mandatory rules around social distancing, around public spaces, around adherence to ensure if you can't social distance or you're at risk of social distancing, then wear a mask. But we've had kind of a situation where there hasn't been a continuity from maybe one business to another or one public space to another. So if we look at that and say, okay, we did the assessment on, is it real that we're not really adhering to what was already in the mandatory order? Well, we found out, and if you want to take St. John's as an example, the adherence level was about 16%. So if that's not good enough, there was as high as 49% and as low as, I think, 11%. So, we need better adherence to the public health rules. And so putting the mandatory order in is timely. It's timely because we believe there's a social acceptance. And if there's not a social acceptance, we've already said we won't be able to enforce it. So while New Brunswick conditions were really good, people were thinking, okay, we're fine. Well, we know from the outbreak in Moncton, we're not fine. And so now it's a case where I believe people will really step up to the plate and follow the public health rules that have been put forward, and now recognize that wearing masks is just one more area that we must adhere to ensure our safety.
Thank you, Premier. Isabelle Larose, Radio-Canada.
Oui, bonjour. La question pour M. Higgs, c'est concernant l'éclatement de la bulle entre la Gaspésie et le Nouveau-Brunswick. J'aimerais que vous précisiez ce que vous voulez dire par bien essentiel. Est-ce que ça inclut, par exemple, le fait d'aller faire une épicerie normale? Et est-ce que à la fois Ici-Bouche ou à tous les résidents d'Avignon, comme c'était le cas là, durant l'été?
What it applies to is immediate community, yes, the way it was before, that we had, essential services that were being supplied from the Campbellton area, whether it be groceries, whether it be dentists, whether it be the hospital. There are workers that are coming back and forth to the hospital. So it is the same restrictions that were on back several weeks ago, maybe a month or two ago, in relation to essential services only. And the day trips, which we had allowed a while back, that no longer will apply. And because it's recognizing the severity of what is happening in Quebec and doing what we can to limit the exposure here in New Brunswick. Earlier it was spoken and mentioned about the Atlantic bubble and will we be able to retain that. I think my colleagues recognize that New Brunswick is the front line here. We're the front line against our neighboring provinces or Maine, so whether it be Quebec, Ontario, whether it be Maine. So we're the front line, and what we're doing is ramping up our intensity on the front line to ensure that we can not only protect New Brunswick, but have scrutiny on all travel that's moving through our province, because the travel is where the risk has been.
Merci, Isabelle. Inda NTR Huddle Today.
Hi, yes, Dr. Russell, before the public health directive was to wear a mask where physical distancing isn't possible. Would this mandatory mask rule allow for loosening of physical distancing restrictions at businesses and commercial properties?
It's not really a substitution for, getting closer to people unnecessarily. There are some seated venues where you could be allowed to be there with a distance of 1 meter wearing a mask continuously. But again, the mandatory mask effort in terms of what we expect and hope that people will be able to do is that it becomes normalized, it becomes very common, and we saw success in Nova Scotia right next door whereby they used an educational and supportive approach, and it really became a cultural norm within a short period of time. So, and again, masks are just one of many of the layering effects and tools for public health measures in terms of the protection of our population, and especially our vulnerable population from COVID-19. We have to continue to look at all of the things that we need to do as the risks increase and balance those with mental health issues, the economy and people's finances, and having an open society as possible while mitigating the risks for COVID-19.
Thank you, Doctor. Thank you. Geneviève Normand, Radio-Canada.
Yes, good afternoon. My question is for Premier. I'd like to go on a different topic, but it's still health related. I was wondering, Premier, if your government is willing to do anything to save Clinic 554 at all, and if you think abortion access in New Brunswick is appropriate for women.
So I think I've answered this question numerous times, and the answer continues to be, we believe we're following the Canada Health rules, and we do not fund private clinics. I've also said to our health networks, Horizon in this case, that if they believe that access is a problem, then I'm expecting they will provide a proposal within our public institutions to address that.
Thank you, Premier. Thank you, Ms. Norman. Dr. Russell, il y a une demande si tu peux répondre la question ou répéter en français la question concernant les nombres d'employés supplémentaires demandés à la manoir.
Ouh,
Tu peux répéter ta réponse en français, s'il vous plaît.
OK. Alors, hier soir, j'avais reçu des informations de le programme extramural, le directeur qui est en charge de la situation comme telle sur le sujet des employés des ressources humaines. Je n'ai pas l'exact nombre qui a été demandé, mais je sais qu'à ce moment-ci, il y avait l'équipe critères, le prompt, l'équipe prompt qui était là sur Terre. Et à ce moment-ci, tous les employés, il y en avait environ 50, ils étaient tous contactés et ils sont tous vraiment considérés des contacts étroits. Alors, on les a testés. Ceux qui étaient négatifs pourraient travailler, mais on va continuer à les tester. Et ceux qui étaient positifs étaient supposés d'isoler. Alors, ça, c'est quoi qui déroule à ce moment-ci. Et alors, s'ils ont des symptômes, ils vont être testés. Mais même s'ils n'ont pas des symptômes, ils vont être testés encore. Alors, ceux qui sont vraiment, à ce moment-ci, on avait 4 travailleurs de santé qui ont testé positif et il y en avait 3 de ces travailleurs de santé qui n'avaient pas de symptômes. Alors, tous les employés, tous les staffs reçoivent des surveillances et des suivis avec la santé publique chaque jour. OK, il y avait d'autres informations que j'avais reçues aussi hier soir. Alors, le développement social, environ 10 travailleurs sociaux qui ne sont pas sur le site comme tel, mais à leur bureau, qui contactent les familles et peuvent communiquer avec tous les contacts étroits et les proches. Ambulance Nouveau-Brunswick, quelqu'un sur Terre pour gérer et coordonner. Le programme extramural, environ 12 staffs qui travaillent avec la santé publique pour gérer et contenir l'éclosion. Et aussi, ils ont établi une manière pour gérer sur le côté clinique de surveillance des résidents et aussi pour assurer que tout est en sécurité pour les staffs et pour les résidents. Et aussi les régies, environ 6 staffs de Horizon pour représenter IPC, alors c'est l'infection et prévention et aussi la facilité de leadership. Alors, so to repeat that all in English, that's a big mouthful of information. I'll start all over. So all of the employees, all 50 of them were contacted and they're all considered close contacts. They've all been tested. Those who tested negative can report to work, but they have to otherwise self-isolate, and they will continue to be tested every several days. If they're symptomatic, they'll be tested sooner. There were 4 healthcare workers who were positive for COVID-19, and 3 of them did not have any symptoms. And all of the staff are receiving daily public health monitoring. And there's so many people working together right now to make sure that the residents and the staff are looked after. So there's a prompt team, which is working with the facility staff, extramural, public health, the regional health authorities and government departments, and regional services are responding to this outbreak. We have staff on site. Some social development staff are off-site, but they are in the office and they are contacting families and helping with communicating with loved ones. Ambulance New Brunswick has an incident coordinator on the ground. Extramural and A&B have provided around 12 staff that are working with public health to help manage and contain the outbreak and establish clinical oversight for the residents and basically to ensure the safety of the staff and the residents. And the RHAs have provided about 6 staff from Horizon to represent the IPC, Infection Prevention Control, and facility leadership. So there are a large number of people working to help with the outbreak and to protect the staff and residents as things unfold.
That concludes today's update. Thank you very much, everyone. Merci beaucoup tout le monde. Voilà la fin de notre mise à jour. Merci beaucoup.